Right, your start of a 10, no conferring. What medical term is used to describe the difficulty in swallowing certain types of food and liquid, sometimes associated with odonophagia and often following a cerebrovascular event such as a stroke? Bonus question A. What fluoroscopic imaging procedure is often indicated to assess a patient's difficulty in swallowing? Bonus question B. Which functional imaging modality is usually indicated for the screening of bone metastases and to determine the extent of any metastatic disease? Bonus question C. What imaging modality is used to assess the risk of osteoporosis, usually in men over the age of 60 and post-menopausal women over the age of 50? Question 2. Your start for 10, no conferring. What type of pneumonia results from the inhalation of stomach contents or secretions of the oropharynx, leading to lower respiratory tract infection? Bonus question A. What conventional radiographic imaging procedure is usually indicated in detecting the presence of intraperitoneal free air resulting from gastrointestinal perforation? Bonus question B. What two imaging modalities are normally indicated for adult patients with suspected osteomyelitis? Bonus question C. Following conventional radiographic imaging for internal derangement of the knee, what two follow-up investigations can be used to assess damage to the ligaments? Question 3. Your start for 10, no conferring. ASB is an initialism for what triangular depression found on the lateral aspect of the dorsum of the hand, also known as the radial fossa? Bonus question A. What type of deviation is usually adopted for the postero-anterior projection of the wrist when a fractured scaphoid is suspected? Bonus question B. What effect does a 30-degree cranial angle have on the scaphoid bone when used with a postero-anterior projection of the wrist? Bonus question C. What radiographic projection of the scaphoid involves the hand and wrist being rotated by 45 degrees externally from the postero-anterior position? Question 4. Your start for 10, no conferring. Anamnesis is an historical term more commonly known as what? Bonus question A. What conventional radiographic projection of the knee is often used in the trauma setting to visualize a lipohemarthrosis in the soft tissues proximately to the patella, also known as the suprapatellar pouch or bursa? Bonus question B. What two modified projections of the knee can be utilised if a tibial plateau fracture is still suspected despite not being visualised on the initial AP and lateral projection? Bonus question C. An intercondylar or tunnel projection of the knee can be used to demonstrate what? Question 5, your start for 10, no conferring. What medical term, sometimes referred to as rickets in children, is used to describe the softening of bones caused by defective bone mineralisation as a result of a deficiency in vitamin D? Bonus question A. What radiographic projection of the ankle involves the internal rotation of the leg until the long axis of the foot is 45 degrees to the image receptor, used to demonstrate the talofibular joint and the tibiofibular syndesmosis? Bonus question B. What name is given to the radiographic projection of the ankle that is not a true anteroposterior projection, but is used to visualise the whole of the ankle joint without the superimposition of the fibula over the lateral gutter? Bonus question C. What rules or guidelines are used to help clinicians determine whether radiographic imaging is required for the foot and ankle? Question 6, your start for 10, no conferring. What does the acronym CRITOL stand for in relation to the Paediatric Ossification Centres of the elbow? Bonus question A. What modified projection of the anteroposterior elbow could be used to visualise the radial head? Bonus question B. What modified projection of the lateral elbow could be used to visualise the radial head? Bonus question C. Ideally, what are radial head projections trying to achieve? Question 7, your starter for 10, no conferring. Where would you find the sustentaculum tali? Bonus question A. Pes planus requires what kind of radiographic AP and lateral projections? Bonus question B. If a fracture of the navicular is suspected, what additional projection may be required to the standard dorsipalmar and oblique projections? Bonus question C. DP projections of both feet are required for the detection of bilateral erosions in which type of arthritis? Question 8, your starter for 10, no conferring. The AP oblique no-guard projection of the hand is more commonly known as what? Bonus question A. In determining the maturity of a child's skeletal system, bone age, which hand and wrist should be used for the DP projection? Bonus question B. When is a lateral projection of the hand normally indicated? Bonus question C. What radiographic features does the Bruton's anteroposterior axial projection of the hand optimally demonstrate in the assessment of rheumatoid arthritis? Question 9, your starter for 10, no conferring. What medical term is given to describe the fixation of a joint by surgery. Bonus question A. Identify 2 reasons why it is important to ensure that rotation is avoided on a PA projection of the chest. Bonus question B. Identify how adequate inspiration can be assessed on a PA projection of the chest. Bonus question C. If a patient over the age of 40 has hemoptysis, what radiographic projection of the chest is indicated in addition to the standard PA projection? Your start for 10, no conferring. Identify the 2 bones marked by a red oval and an orange circle that can be seen on the following radiographic projection of the wrist. Bonus question A. Identify the bone indicated by the pointed purple arrow in the following image. Bonus question B. Identify the following tendons indicated by the yellow and orange arrows in the following image. Bonus question C. Identify the cavity indicated by the blue oval and the prominence indicated by the red oval in the image below.